with my master's degrees in epidemiology. I started working out on clinical trials. I've been with the healthcare system for over 11 years now, mostly working in either clinical trials or data related. So I've been a data analyst, I've been a methodologist, I've been working as like a project lead for different projects across the hospital. So various different aspects of healthcare. I decided to teach because one of the main things that I'm doing in my current role is a lot of teaching other staff how to use different data tools and also just like basic stats on how to do certain things. And I realized I really enjoy teaching, and this looked like a great opportunity. So I wanted to jump on it and help teach, and also like not only help others become better in what they're doing, but also enhancing my own skills. And I think this was like a great opportunity for me to be able to do that. And I teach the data quality course as well as intro to statistics. So I like to make it as interactive as possible. Less me talking, more discussions is usually the way to go, especially in a courses like data quality. But then there are other classes like stats where it has to be more, let's give as multiple examples as possible. So it does vary depending on my students and also like the topic that we're talking about. I've taken a course myself in Universal Design for Learning, so I like to incorporate that into my teachings as well. So give students ample opportunities to be able to use different methods to basically uh, show me that they are learning. I don't want it, it's not simply just, okay, one quiz, you're done. It's more like, okay, let's also do assignments. Let's do presentations, discussions, just to get a better understanding that they are actually understanding and learning. I think it's very important to understand where your data is coming from. If you are just storing away things and not understanding where things are coming from, it's difficult to be able to use that information and store it correctly. It's important to understand what data quality really means. And I think if you understand the stats part of it, it would actually help you manage your data information correctly in patient data. If you're not understanding the purpose of it, you might just be storing things in ways that actually doesn't make sense when you're ready to use that data. Back to the point that I just made before, you have to understand your data to be able to use it. The people that are using it rely on people that are taking care of the data, making sure the data warehouse is up to date, that your data is secure, and you need, so it kind of goes hand in hand, really. You have to know one to do the other. And if you don't have that background, it's very difficult to understand the storage process as well. You can use Excel to do a lot of different statistical analyses. There's actually a great course with Ashton College that I help teach where we use basically Excel to do all parts of statistics. However, there are more advanced tools like R and SAS that are also very good to learn. Another thing that's could be helpful is learning about different EMR systems. One of the bigger ones is Epic, for example. If you're able to get some content on how the data structure occurs, that would be very useful. So if you want something that's more simple, I recommend Excel. But if you want something that's more versatile and you can actually use it in different aspects of different career paths, I definitely recommend something like R. So the program is 100% remote learning. It's online. Some of it is on your own time. And so I think dedicating a certain number of hours per day to get your coursework, just so you can stay on top of it, is essential. And I think also really engaging with other students. Don't only, it's sometimes, especially like in a virtual setting, it's very easy to just be narrow-minded and do your own thing, and you're not taking advantage of other students that are taking things as well. It would be nice to have that sort of community where you are able to talk to other students, just like if it was in a real life in-person setting. So I think, yeah, that's it's more broadly related to remote learning in general. I think it's a great program, and I think the types of classes that are available, especially for DHIM, is very useful, especially if you're looking to get certified in health information management. It's very well curated with lots of broad topics, and you can actually branch out to other things. It'll maybe pique interests even in other careers, which is awesome.